Medicine treats, but nursing heals. So, welcome to my channel, Revolution in Nursing. And today we are gonna do a very important topic and very demanding topic, that is schizophrenia. Have you heard about this term? Or are you confused about what is schizophrenia, what are its type, etiologies, and how a person behaves in schizophrenia? So let me tell you guys, this is the best video you can ever have. So in schizophrenia, let's begin today's topic with definition. Schizophrenia. Schizophrenia comes from the Greek word, that is schizoid and phrene. Schizoid means split and phrene is mind. It means that your mind splits. What does that mean? Means the person is not able to think. So, in schizophrenia, there are basically 4 disturbances, and these 4 words you have to keep in mind to understand the schizophrenia. It's the whole concept of schizophrenia revolves around these 4 words. First is thinking, second is perception, third is affect, and fourth is behavior. So you can learn it by trick also, that is P tab, means people, today's people have tab. P stands for perception, T stands for thinking, A stands for affect, and B stands for behavior. So in schizophrenia, it is the combination of hallucination, delusion, extreme disorder thinking, and behavior that impairs daily functioning and can be disabling. So I told you about P tab. So just remember about these 4 words which are very important. So in schizophrenia we have 2 definitions. First is given by Merriam-Webster and second is M.S. Bhatia. First is Merriam-Webster. A mental illness that is characterized by disturbances in thought, I told you, perception, behavior, and affect, that is emotional response, and extreme apathy, by a noticeable deterioration in the level of functioning of everyday's life. Easy? So what Merriam-Webster says, that mental illness is something which have disturbance in, says that mental illness in which thought, behavior, we have perception and affect is affected, which deteriorates the person's daily life, is the schizophrenia. And M.S. Bhatia said the group of disorders that is characterized by thinking, disturbances in psychomotor activity, affect, perception, and behavior. So same thing but in 2 different ways. So these are 2 definitions. Next is historical background. First point is that schizophrenia was first identified by Dr. Kriplin. Important. Second is term schizophrenia is coined by Eugen Bleuler. You can learn it by that the person Bleuler blew mind of the people by coining the term schizophrenia. So third is Kurt Schneider described the form psychotic symptoms and distinguished schizophrenia from other psychotic disorders. Basically, what does it mean? That he distinguished on the basis of symptoms, and those symptoms are called Schneider first rank symptoms. So he basically, what does he did, that he distinguished schizophrenia from other psychotic disorders based on the symptoms, and those symptoms are known as neither first rank symptoms. World Schizophrenia Day is observed on 24th May. So these are the 4 points which you need to keep in mind. Who identified schizophrenia? Dr. Kriplin. The term schizophrenia was coined by Bloor, and Kurt described the first rank symptoms. And 24th May is the Schizophrenia Day. Then is the incidence and prevalence. It is 0.32%, which you need to keep in mind. Then after incidence and prevalence, we have etiology. In etiology, first is genetic theory. What is genetic theory? Says that there is 1% chances that is caused in general population, 10% in first degree relative. First degree relative means which are directly like your uncle, your aunt, your cousins. Then is identical twins have 44 to 65% chances of having schizophrenia. Second is neurological factor. Neurological factor means related to brain. First is dopamine hypothesis, second is serotonin hypothesis, third is different brain chemistry structure. What does these three means? So, is dopamine hypothesis. The dopamine hypothesis means there is excessive amount of release of dopamine in the mesolimbic and cortical brain regions, which is the cause of schizophrenia. We know that in schizophrenia there is disturbance in the thought, affect, perception and behavior. So this why does that occur? It is due to the increased activity of dopamine. So first is dopamine hypothesis, second is serotonin hypothesis. This work similarly to dopamine. Serotonin is also called happy hormone. So when stress induced excessive serotonin activity occurs in the cerebral cortex, schizophrenia occurs. Okay, so where does dopamine act? It acts in the mesolimbic system, limbic system, which is responsible for our emotions. So dopamine hypothesis is and serotonin hypothesis both indicate one thing, that these hormone activity increases in their respective areas which associated with the schizophrenia. Third is different brain chemistry and structure, means ventricles become larger in some people and the gray matter is less. Gray matter which increases your concentration, so it becomes less. Now these are the neurological causes. Now next is environmental factors. In environmental factors means around you, what are the causes or etiologies which can lead to schizophrenia? First is living in urban environment during childhood. Why it is saying urban environment? Because as you all know that nowadays people are living in urban area, and in urban area we don't have that much social interactions, means we are not happy. All are busy in their all are busy in their own work. So at home also the mother works, the father works, and the child is remain in the house with the maid or sometimes alone also. So but if the same condition is applied in rural area, the child is taken care by grandmother, grandfather, and there are many more. So environmental factor, first is living in urban area during childhood, second is social isolation, third is racial discrimination, meaning based on race, fourth is family dysfunction, fifth is unemployment and poor housing conditions, that also gives stress. Then next is childhood experience of abuse trauma, and last substance abuse and drugs consumption. Fourth is socio-cultural factors. Socio-cultural factors means how you socially interact. So first is life events, and second is Interpersonal communication. Life events means what are the events that occurring in your life. Like for example, you are going in college, so how you are interacting with teachers and your classmate. Then is interpersonal communication, how you are maintaining it, you are avoiding socially withdrawal is present, or you are extrovert. Then third is expressed emotion, how you expressed your emotions. Now, the fifth one is psychological theories. In this, we are going to study three theories. First is psychodynamic, behavioral, and cognitive. There are many more theories, social theory, but in schizophrenia, we are going to study these three theories. First is psychodynamic theory. This is very interesting theory, and I always like the psychodynamic theory, which is given by the which is derived from the psychoanalytic theory of Sigmund Freud. Basically, it talks about ID, ego, and superego. How they work. First, we have ID. If you don't know about these words or these terminologies, please go and watch my top 100 nursing terminologies, in which I have explained various terms which I am gonna use or you will gonna study in your further studies of psychiatry. So in this, psychodynamic theory is basically tells that there is disturbance in the ID. ID means your inner instinct, in which you are going to think about yourself only and there are no moral values. Ego is means you use your intellectual ability and try to convince your ID. And super ego means you know what is right and what is wrong and what you are gonna do, and accordingly you will act. So in psychodynamic theory, abnormal upbringing, for example, there is abnormal bringing of a child in a family. So what it will do, it will result in weak and fragile ego. Okay, ego means inner conflict. You will become weak, you will not able to talk to anybody, and there is inner conflicts and there is suppression of anger towards your family, but you, that anger is all projected in yourself. So ego ability to control id's desire. I told you that what ego will do, it will controls the id desire. So the ability, because ego has become fragile and weak because of the abnormal upbringing or scold, when your parents scold you, or when they will beat you, or any abnormal behavior that is shown by the family members, so it will break your ego and ego will not able to control your desires, so your desires become limited. Then this leads ego to broken apart by its attempt to control id. So the person loses contact with reality, means you will think, I told you, after id ego comes, and ego you use your cognitive ability, you think about the reality, how it works. So when ego is disturbed, then you lose your contact with reality, then you lose your contact with reality and use the defense mechanism like regression, primary narcissism, denial, regression, projection. Okay, these all are the defense mechanism. If you want what all are the defense mechanisms, then please comment, I'll definitely tell you what all are the defense mechanism with a master mind trick by which I have learned and I have told many others also, and they have gotten benefit out of it. So these all are the defense mechanism which the child use. So I tell you what is regression, in which the child behaves in which the child goes into earlier stage like thumb sucking, objection, in which he in which the child projects his mistake onto others, that because of him I have not done my work. Next is, now the person is dominated by their ID instinct because ego is disturbed and incapable of organizing their own behavior, and is not able to organize his own behavior because there is only ID desires left in him and want to achieve everything which he wants. So he developed delusion, hallucinations as a result of their basic inability to distinguish between imagination and reality. So this is what Sigmund Freud had told, and according to psychodynamic theory, basically there is, in short, if I tell you that the in this ego is broken apart, not able to maintain contact with reality, so dominated by ID instincts, and delusion, hallucination occurs, and imagination and reality, and they are not able to distinguish between their imagination and reality. So this is all about psychodynamic theory. Now the next is what is behavioral theory and cognitive theory. So it's believed that the disorder tends to run in family, so it is possible that people may learn to exhibit symptoms through observing their people around and positively reinforce the attention of others. What this statement means, it simply means that the person learned from its environment through the behavior of others surrounding the person. So it is a learned behavior. In this, the person, like I told you, in this thinking is affected, perception is affected, affect and behavior is affected. It basically means that in behavioral theory, it basically means that in the families this disorder run, the person simply learn from its surrounding people, and if he gets attention by the others, it is positively reinforced. Positively reinforced matlab, if the surrounding people care about the person may get positive attitude towards his disease. Next is cognitive. Cognitive means when he uses his when they uses their brain. So when the individual experiences symptoms like hallucination, what they do, they try to validate them. Means they go to other person and tell about how they feel, they are hearing noises or they are having hallucinations and delusions, so they tends to validate their experience to others. And when they are not able to do that, the person begins to believe that, means not able to do that means when his experience is not validated, means the other person denies that no, it cannot happen, you are wrong. So the patient thinks that they are hiding something from him, and he get paranoid behavior, so which causes individual to reject the feedback. So the patient, he rejects their feedback and develop delusion beliefs that they are being manipulated, that other person is manipulating him. So how these theory work is very simple. Psychodynamic, in which ego is disturbed; behavioral, in which he exhibits symptoms through observing other people what they are doing; and in cognitive, the person they reject the feedback of others and and develop delusion beliefs. So these are the three psychological theories. Next is classification. Classification are also very interesting. This whole topic is very interesting. So in classification, first we are gonna study paranoid. Second is disorganized. Third is catatonic. Fourth is, actually we are going to study fourth, simple. Fifth is undifferentiated, and sixth is post schizophrenic depression. So these six are the classifications of schizophrenia. As overall, I just convey you what is paranoid. Paranoid is just in which the person develops delusion. It is always like other people is gonna hurt him, or they are telling him lie. So he is always in paranoid condition. Disorganized means there is disorganization of his thinking, disorganization of his mood, disorganization of his activity, which is known catatonic activity. Then third is catatonic type. It is of two types. One is stupor and second is excitement. Stupor means the person didn't do anything and is lost interest, but in excitement he is overexcited and he do what is not necessary also. Then next is simple. Simple means there is no delusion and hallucination, but there is development of negative symptoms. In this, negative symptoms are developed. The next is undifferentiated. Undifferentiated means we are not able to differentiate that is paranoid or disorganized or catatonic. So the behavior in which all three are not, can say that the person is paranoid or disorganized, catatonic, then we can say that it is undifferentiated. And last is post schizophrenic depression. Post schizophrenic depression means in after schizophrenia the depression occurs in the person. So let's study in detail. First is paranoid. In paranoid, preoccupation with one or more delusion or frequent auditory hallucinations. Very important word, delusion and hallucinations. So in this, none of these is prominent. Okay, we are categorizing into three things: disorganized speech, disorganized behavior and disorganized affect. So in paranoid, none is prominent. None is prominent means there is only hallucinations and delusions. These are okay. But in disorganized, which is also known as hebephrenic, in this there is presence of disorganized speech, disorganized behavior, flat or inappropriate affect. So there is disorganized type. Okay, and last it is written that this criteria are not met for catatonic type. What does it mean? That how we are using these three criteria for paranoid and disorganized, we won't use it for catatonic. So in paranoid these three are not prominent, but in disorganized these all are prominent. What does it prominent in paranoid? Delusion and hallucinations. Okay, so now the third is catatonic. In catatonic type, at least two of the following must be present. First is motoric immobility, means there is no movement. Okay, like catalepsy, including flexibly, or stupor, means no movement. Again, these terms, watch my terminologies video, I have explained in detail. Or there is excessive movement. First is motoric immobility, second is excessive motor movements. First is the person will not move, second is there is excessive movement, third is extreme negativism, means whatever you tell the patient, he will do just the opposite, he won't do what you will say. So there is resistance to all instructions, or we can say mutism. Fourth is peculiarities of voluntary movements. What does peculiarities means? Means what are the voluntary movements are associated with voluntary movements. Like we have stereotype behavior, means again and again mannerism in particular manner without consciously, which is known as unconsciously the person do, or grimacing. So these are the peculiarities of voluntary movement. And last is echolalia or echopraxia. So what is echolalia echopraxia means? Simply, echolalia is imitation of words, and echopraxia, X for exercise, you can learn it, it's action. Okay, so these are the catatonic type. Catatonic type we have two. One is, I told you, stupor, and other is excitement. These are the clinical pictures, means sign symptoms, which at least two should be present for catatonic. For paranoid and hebephrenic, I told you that the criteria is disorganized speech, then catatonic behavior and disorganized affect. And for this catatonic behavior type, we have motor immobility, excessive motor activity, negativism, stereotype mannerism, echolalia and echopraxia. So next is clinical manifestation. Clinical manifestations are, we are gonna study into three categories. First is on the basis of symptoms. Second is Eugen Bleuer. I told you who was Bleuer, who coined the term schizophrenia. And third is first rank symptoms of schizophrenia. Who gave first rank symptoms? I already told you, it's Kurt Schneider. So on the basis of these three, we are going to study the clinical manifestations. So let's begin. On the basis of symptoms, first we have positive symptoms and second we have negative symptoms. So what are positive symptoms? Positive symptoms means there is increase in abnormal behavior like hallucinations, delusion, bizarre behavior, disorganized thought. Okay, and in negative symptoms there is absence of normal behavior. These are also known as 5 A's. What are 5 A's? Alogia, anhedonia, affective flattering, asociality, avolition. Alogia means decreased speech or absence of speech. A means absence, alogia means decreased speech. Anhedonia means there is decreased interest of the patient, means he won't go for any parties or any pleasurable activities which he likes to do, but now there is no interest of the patient in it. Next is affective flattering. Flattering means flat, means there is no emotions in the patient. Next is asociality, which means the person won't socialize, and avolition means lack of motivation. So I already tell terminologies of psychiatry, you must watch for clearing all the terminologies which are you gonna use in the future. So these are the positive and negative symptoms which you have to remember. Next, we are going to study about cognitive symptoms, Eugen Bleuer 4A's, and first rank symptoms of Kurt Schneider. So cognitive function means there is impaired mobility, memory, lack of decision making, impaired planning, impaired attention, abnormality in thought process. Next is Eugen Bleuer. What are the 4 A's? 4 A's. First is ambivalence, means there is person is not able to decide between the two and get confused. First, the emotions occur one, means there are two types of emotion occurring at the same time. Next is autistic thinking, which is present in autism disorder mainly, in which the person is engaged in himself only and doesn't care what is happening around. I will explain with example also in my video of terminologies. Please go and watch it. Next is affect disorder disturbances, in which affect is disturbed, and last is association disturbance, in which the person not able to associate. What does association disturbance means when a person is talking about one topic, then there is looseness of association, means he jumped on to next topic and there is no connection with the previous one. So there is association disturbance. So ambivalence, autistic thinking, affect disturbance, and association disturbances. Now next is first rank symptoms. I told you in the first place when you are starting the video that to learn PTAP, thinking, affect, behavior, perception. It's the same thing. So first is delusional perception with which the patient have. Next is auditory hallucination. Third is delusion of thought perception. What are all the terms which comes in thought perception? First is insertion, withdrawal, and broadcasting. Last is delusion of control, passivity, or made phenomenon. So if I explain you all these four terms, let's begin with first one. First is delusion perception. What is delusion perception? In which there is false fixed belief in the person, and the person thinks, and the person made a false belief in his mind and won't listen to anybody if the other person corrects him. Next is auditory hallucination, in which he listens, in which he hears sounds which are not present at that time. Third is delusion of thought. First is insertion. Insertion means the patient thinks that someone is inserting something in his mind. Second is withdrawal, means the patient think someone is withdrawing my thoughts from my mind. Third is broadcasting, means the patient think whatever I am thinking in my mind is broadcast by someone to everybody and everybody can listen to it. Last is delusion of control, means someone is controlling me and whatever I am doing is not done by me, someone else is making me to do it, which is also known as passivity phenomena or made phenomena. So these are the symptoms. Next is phases. What are the phases of schizophrenia? First is prodromal, second is active, third is residual. Prodromal phase means there is starting of appearance of negative symptoms. The patient starting to have disorganized thought, means it's the starting phase in which the patient is having disorganized behavior, disorganized affect, disorganized thinking, and there is negativism in patient behavior. Second is active phase, means the patient is now having schizophrenia and it's the condition of the disease and it is the period of condition of schizophrenia. Last is residual phase, in which after all the treatments the patient is now okay, but there is residuality of some symptoms and chances of relapse also. So these are the phases of schizophrenia. Now the next we are going to study about diagnostic criteria. First is DSM-5 and second is ICD-11. So in DSM-5, category A is schizophrenia spectrum and other psychotic disorder. At least one should be present: delusion, hallucination, disorganized speech, disorganized behavior, which is now catatonic behavior also, and negative symptoms. Very easy. We are beginning the whole video from these terms only. And second is social dysfunction for at least 6 months. So if the patient have first category of at least 1 out of 5 for at least 1 month and social dysfunction at least 6 months, then the patient we can consider it as schizophrenia. And according to ICD-11, at least 2 symptoms must be present in this. like positive symptoms, which I told you. What are the positive symptoms? Like bizarre behavior, hallucinations, delusion. Negative, there are 5 A's: anonia, alogia, affective behavior, asociality, avolition, or depression or manic cognitive symptoms, means impaired in thinking. So at least 2 symptoms are present in this, or out of these 2 symptoms, at least one. Like, what are core symptoms I am trying to tell you? Like, let's take positive symptom. So in positive symptoms, there are 3 5 categories I told you, like delusion, hallucinations, bizarre behavior, cognitive behavior. So at least one core symptom should be present, like delusion or thought insertion, thought withdrawal, hallucination, thought disorder. And at last, this symptom should be present for at least 1 month. So at least 2 symptoms, and of that one core symptom for 1 month. These are the diagnostic criteria. Now next is treatment. What is the treatment we are gonna do? Treatment first is hospitalization, but not every cases require hospitalization. The criteria for hospitalization can be if the person, if there is risk of violence, if there is risk of suicide, or the patient harms other person, or the patient have severe schizophrenia, or the patient is treatment resistant, then the patient can go for hospitalization. Second is antipsychotic medications. So there is a classification of antipsychotic medications: typical and atypical. And atypical antipsychotics include olanzapine, clozapine, risperidone, qutipin. And typical psychotics include chlorpromazine, which is the first antipsychotic which is discovered, then haloperidol. So these are the classifications. So if you want a full video of antipsychotic medications or psychotherapy or psychopharmacology, or about psychopharmacology, all the what are their side effects and what are the indications and contraindications, please comment. I'll definitely post it. Then next is psychosocial treatment. In psychosocial treatment, problem specific psychosocial treatment is given: family psychoeducation, then day hospital vocational rehabilitation, and educational opportunities is provided, and access to crisis counseling. Means these are all the counselings and education which is provided, which occurs in psychosocial treatment. Then next is nursing diagnosis. So nursing diagnosis, what all nursing diagnosis you can form? First is disturbed thought process, which is first is disturbed thought process, or disturbance in cognitive operations and activity related to disorganized thinking, as evidenced by non-reality based thinking, disorientation, या labile effect. So first is disturbed thought process. Second is disturbed sensory perception, which can be anything: visual, auditory, gustatory, tactile, olfactory, related to hallucination where the person is having, as evidenced by diminished or response to stimuli. Third is disturbed personal identity, which is related to aggressive behavior, which is related to regressive behavior. Means personal identity disturbed means the person is not able to distinguish from self and non-self. And to which it is related, loss of ego boundary. I already told you in psychodynamic theory. Other also nursing diagnosis can be formed. For example, risk of violence. Next, balanced nutrition requirement less than body requirement. Next, risk for suicide. Next, disturbed interpersonal communication. So these are the nursing diagnoses which can be formed according to patient requirement. Now, after nursing diagnosis, we are going to study about other psychotic disorders. This is the last part. Schizophrenia is completed, in which, let's recall, first we have learned about what all we have learned. First we have learned about definition, then which are given by Merriam-Webster and H.S. Bhatia. Next we have learned about history and incidence and prevalence. Next, what are the etiologies. Next, we have learned about classification. Next, we have learned about clinical manifestations. Next, diagnostic criteria. Then nursing diagnosis, and also phases of schizophrenia. Now we came to other psychotic disorder. First is schizoaffective. Schizoaffective means there is, along with schizophrenia, the mood also affected, means there is presence of mood disorder along with schizophrenia. What all comes in mood disorder? Like mania and depression, means along with hallucination and delusion, mania and depression also occurs. What are the types? Schizophrenic disorder, manic type, depressive type, and mixed type, in which both mixed means in which mania and depression both occur. So this is schizoaffective disorder. Easy. Next is treatment. We can give antipsychotic drug and psychotherapy, in which we educate the person about coping skills or social skills and reduce social isolation. To treatment, we have second type, which is schizophreniform. It is a short term for schizophrenia, means it is schizophrenia, but thus it occurs for short period of time. How much short? 6 months, means at least the symptoms should be present for 1 month and it prolongs to 6 months. So when the schizophrenia occurs for short period of time, it is called schizophreniform. Now the next is third type, brief psychotic disorder. Brief psychotic disorder means the patient have sudden short period of psychotic behavior. Psychotic behavior, there is difference between psychotic and neurotic. If you don't know, I'll tell you. Psychotic means there is absence of insight and judgment, but in neurotic there is presence of insight and judgment. So in brief psychotic disorder, there is short period of psychotic behavior, usually less than a month, after which the person usually recovers completely. So when there is stress in the person and it lasts for less than 1 month, it is called brief psychotic disorders. The classifications of brief psychotic disorder, it is, first is when the psychotic disorder occurs with postpartum onset. Second is without obvious stresses, means there is no outside stressor present, then also brief psychotic disorder is occurring, and when outside stressor is present. So these are the three classifications of brief psychotic disorder. Now the next is treatment. What is the treatment? Same, we can give antipsychotic medications and psychotherapy, and hospitalization also in case of severity. Next is shared psychotic disorder. Shared means when the normal healthy person share the delusion of person with psychotic disorder, means if a healthy person who is living along with psychotic patient also gets delusional affects is known as shared psychotic disorder. So you have heard you also get mad because you are living with him. So in psychiatric terms, this is known as shared psychotic disorder. So now the next is paraphrenia. What is paraphrenia? Means paranoid schizophrenia. I told you about paranoid schizophrenia, in which delusion hallucination occurs and the patient is suspicious of the other person, that he is going to kill me or any other thing. Means there is suspiciousness of symptoms occur in the patient. So it is the short term of paranoid schizophrenia, but this have preserved effect. Means the effect is not affected and the effect is preserved, and less personality deterioration occurs. Means we can say that it's the little brother of paranoid schizophrenia, in person can maintain its personality. So it is schizotypal disorder. It means the person is not able to form social relationships. Yeah, is difficulty having close relationship with other people, and there are peculiar speech mannerism in which patient repeats one thing, and fear of social gatherings, have anxiety in social situations. Means he is not socially active. This is called schizotypal schizophrenia. Next is delusional disorder. So in delusional disorder, we are using this word delusion from starting, so you must have known this word. It is basically occurs in middle and old age, and insidious onset of long-standing non-bizarre delusions. Means if they are not understandable, they are out of keeping with life ordinary experience, involve situations that do not plausibly occur in real life. Means basically fixed false beliefs. We can say you can learn these three words: fixed false belief. The person has a belief which are false and they're fixed. Means you cannot convey the patient that these are not true and you should not follow this. This all occur in delusional disorder. What are the subtypes of delusional disorder? First is persecutory. In which the patient feels that someone is gonna kill me. Second is grandiosity, in which the patient feels that he is grand of grands. Means he is grand of all. No one is bigger than him. So this is called grandiose. Third is erotomanic. It means when a person in superior position is in love with the other individual but not able to express because of many obstacles. It may be anything. So that is erotomanic. Next is jealous, when the partner is jealous of his or her partner when he or she talks with another. It is also known as Otella. ELLA. OTHELLA. And next is somatic, in which the patient has, somatic means related to body. So when he have delusion related to his body, about his body configuration, is called somatic delusion. There are many other delusion also, like delusion of control, delusion of reference, delusion of infidelity. Now the next is hallucinations. What are hallucinations? It's just unusual sensory experience, yeah, or perception of thing. Means the thing which is not present but In auditory, we hear it. In visual, we see it. In gustatory, we feel it, means taste it. In tactile, we feel something on our body, means that is not present, but we feel it. So these are the unusual sensory experience or perception of thing that are not present, such as seeing things that are not there, hearing voice, smelling odors, having a funny taste in your mouth, and feeling sensation on your skin even though nothing is touching your body. Now, last but not the least, classifications of hallucinations. First is visual, in which the person see which is not present. Auditory means listen. Command hallucination means someone is commanding but no one is there. Olfactory means he is smelling something. Tactile means feeling. Gustatory means taste. And general somatic sensations, but there are no sensations present. These are the classifications of hallucination. So thank you for watching. Hope you like it. So like and subscribe my video, and please comment how you like it. And there is much more waiting for you. And begin this journey of revolution in nursing with hope and desire to achieve big and fulfill all your dreams of parents. Thank you.